Well, welcome to Rotary, everyone. It's absolutely fantastic to see you all. We have a number of guests on today, and just to keep us on schedule, I'm not going to introduce each of you by name, but welcome. We're so pleased to have you here. We have our wonderful greeters, Teresa Atkinson and Bill Douglas, to get us started.
Hi, everybody. Welcome to Rotary. Happy January. We made it through 2020. Nice. You're muted, Bill.
Bill is on, but maybe muted. All right, well, welcome from both of you and welcome to all of you. Thank you again for all being here today. Our music is brought to us today by Nick Helms. Nick.
Hey everybody, I am going to be, Carolyn is going to be playing a trumpet rendition that I did a few months back, and I'm gonna have to start working on some more of these because I'm running out of material to share with the Rotary group. But this is called Concert Etude, and it was the very, not the very first, but it was a trumpet solo that I played in my senior recital in high school. And I found an arrangement of it for 12 trumpets. And so it's by Alexander Gedicke and arranged by David Hickman, and I hope that you will enjoy it.
absolutely incredible. And you can't run out of music. You can't. We want to continue this. It's just such a delightful part of our Rotary meeting to have you, Nick. And I did wonder about the t-shirts. Do you wear a different t-shirt so that you can keep track of each particular part that you're recording on purpose?
No, in other ones I've worn the same t-shirt. I just wanted to make it seem like I was a different person for every shot.
Well, that is just absolutely cool. Thank you so very much for sharing that. Next on our agenda is our invocation with Bob Romero. Bob.
Thanks, Jennifer. I had no idea that all trumpet players looked alike. No, that was great. Thanks, Nick. I was asked to do the invocation, and looking at, obviously, Monday is Dr. Martin Luther King Day. And as we celebrate that, Dr. Martin Luther King not only stood for equality and justice and civil rights, but was also a pastor and a reverend. And so one of the things I thought I would do for today is I looked up some prayers from Dr. Martin Luther King Jr., and I thought I would share his words from one of his prayers that he had offered at a public event. So if you will, join me in these words of prayer from the Reverend Dr. Martin Luther King Jr. Lord, we thank you for your church, founded upon your word, that challenges us to do more than sing and pray, but go out and work as though the very answer to our prayers depended on it. Help us to realize that humanity was created to shine like the stars and live on through all eternity. Keep us, we pray, in perfect peace. Help us to walk together, pray together, sing together, and live together until that day when all God's children, black, white, red, brown, and yellow, will rejoice in one common band of humanity and the reign of our Lord and of our God, we pray. Amen.
Thank you, Bob. Beautiful words. Next, we have a little piece of business to accomplish today, and that is a vote, our first Rotary vote on Zoom with our entire membership, and that is to approve our Board of Director nominees, and they are Quinn Dallin, we've got Jordan Matson, and then also Sonia Rodriguez-True. So those three have been nominated to your Board of Directors, and I believe that Bob Romero has a motion to make.
I move that we approve the slate of nominees for our Board of Directors.
This is Deb Sterling, and I would second that.
Wonderful. So we do have a motion and a second, and we're going to hold our vote via Zoom. If you would all just please raise your hands. If you approve, please raise your hand at this moment. And any nays? Well, seeing none, that motion carries, and congratulations to our newest members of the Board of Directors. We are so excited to have you start your term officially in July, but look forward to seeing you on Zoom if you wish to join us in the meantime. So thank you all. Next on our agenda, we have Deb Sterling with our Sergeant at Arms. Deb.
Thank you, President Jennifer. You know, it's customary for our Sergeant at Arms segment to follow a theme related to our guest speaker. And it's also customary for its Sergeant at Arms to be humorous, sometimes downright silly. As I recall, last time I was Sergeant at Arms, I forced you to look at pictures of my new kitten. My job today for preparing this segment was going to be easy. I mean, how many funny stories have we all heard about hospitals and doctors and nurses? But I got to tell you, in the midst of this horrific pandemic, not one of those stories came to my mind. I can usually find humor in anything. I even laugh at Bob Romero's jokes, but not today. All I could think about was people on ventilators and stalwart doctors and nurses working hard, even through mental and physical exhaustion. And you all know the story. We've heard it, we've heard it, we've heard it. But I'm not going to tell any jokes today. I'm going to just ask everyone to take out a piece of paper or open a new document on your computer and jot down a few numbers for me. So I'll give you a second to get your paper. How many doctors do you know personally? Jot down the number. How many nurses do you know personally? How many of your friends or relatives were sick with COVID? Not just tested or not quarantined, but how many of your friends or relatives were actually sick with COVID-19? How many of your friends and relatives have died from COVID-19? Now add all those numbers up, and I'd like you to share them in the chat as quickly as you can so we can get an idea. My number was 14, but if you share them in the chat, that would be great. I see 39. Wow. 36, 49. Boy, my number 12. That's great. So you know what I'm going to say next, right? Whatever your number was, send that many dollars to Carolyn for your Sergeant at Arms assessment today, if you can. I would really appreciate it if you could do this. I'm counting on all of you to honor the four-way test and follow through on this. I think in honor of those doctors and nurses and friends who have suffered from COVID-19, maybe we can put a few extra shekels in the coffers for Rotary. Thank you. Back to you, President Jennifer.
Thank you so much, Deb. Appreciate that. Now we've got our speaker introduction, and that's going to be done by Dave Hargraves. Dave.
Thank you, President Jennifer, and my virtual fellow Rotarians. I'm honored today to introduce our speaker, Carole Peet. Aaron, we've got you beat because Carole was selected out of 90 applicants for the position of President and CEO of Memorial Hospital. Before becoming President and CEO, Carole was an Executive Vice President of Northern Arizona Healthcare and Chief Administrative Officer of Verde Valley Medical Center. Prior to her service there, she served as President and CEO of St. Anthony North Health Campus in Westminster, Colorado. Following her passion for providing healthcare access to the underserved, she partnered with a community partner there, and together they led the transformation of a standalone acute care facility into an organization providing comprehensive behavioral health services. She began her executive leadership experience as a chief nursing officer and assistant administrator of patient care services at Sutter Coast Hospital in Crescent City, California. Carole earned her MBA from the University of Phoenix, a master's degree in nursing administration from the University of New Mexico, Albuquerque, and a bachelor's degree of science in nursing from Seton Hall in South Orange, New Jersey. She is a fellow of the American College of Healthcare Executive. Carole's no stranger to Washington State. She also served as president of St. Anthony Hospital in Gig Harbor, where she led the opening of a brand new hospital, including the project management, hiring of the staff, building an organizational culture from the ground up. In her spare time, which she doesn't have any of late, she enjoys hiking, and she's also a very accomplished musician. So once we can get the symphony back up, you may be seeing Carole there. Healthcare, as many of you know, is incredibly complicated. And I will tell you that Carole has demonstrated incredible resilience. She began her assignment as CEO and president of Virginia Mason Memorial the beginning of February. Immediately thereafter, we were hit with a pandemic, the likes that none of us have ever seen. As though that wasn't enough, we then had a survey from the Department of Health, which is always a very laborious endeavor, requiring many resources, and particularly during COVID. And then, of course, the rather abrupt closing of Astria Regional Hospital, which made Memorial the only hospital and emergency room in Yakima. Throughout all these challenges, she has remained poised and showed exceptional leadership. So I want you to give a warm Rotary welcome to the president and CEO of what is now Yakima Valley Memorial Hospital, Carole Peet. Carole?
Thank you for that very nice introduction, Dave. And I am going to pull up my screen and share with you my presentation. Yeah, there, I successfully completed that task. If you had asked me how to do that 6 months ago, I wouldn't have known how to do that. So thank you all for this opportunity to talk to many of you I have met somewhere along the Zoom world, or maybe in the brief time that I had before COVID hit, to meet several of you in person. And I do believe that Aaron put this on the books back in February of 2020. Little did we know that so many things would transpire in 2020 that would be really worth conversation and really impact healthcare in Yakima. So I'm going to spend a little time today really talking about the past year and where we're at, and then where we are future focused as an organization. So I do have to remember how to forward this. Okay, I don't know if I've had to do that before. I might have to get my assistant here.
Should be able to just click on the screen.
Just hit an arrow button.
Yeah, I don't have an arrow button. Okay, where's the
Up,
arrow?
down, sideways.
It doesn't look like it normally does. Oh, I found it. Sorry. You're having to put up with my limited technology skill sets. I say to people, that's what happens when you've had an assistant that provides you all that support for all those years. You forget how to do the basics. So as Dave mentioned, 2020 certainly created a lot of healthcare challenges in Yakima. And that all started in January of 2020 when, after many years of financial challenges, Astria Regional declared bankruptcy and closed, and left Memorial as the only acute care facility serving the Yakima Valley. And if that wasn't enough, in 2020, we also went through some very challenging discussions of whether we were going to continue with our affiliation with Virginia Mason and further affiliate with CHI Franciscan, or what was the right thing to do for Yakima long-term regarding access to care and healthcare. And after a very arduous and very focused work, the Memorial Board made the decision to unwind from their affiliation and become an independent, unaffiliated healthcare organization. And I will tell you that was a very brave decision on their part, because you typically will not see that in healthcare in this day and age. And I'll explain to you why. It's really, as we go further into our presentation, you'll see some of the challenges of the healthcare landscape nationally and locally. So Memorial has a very long history of serving the Yakima community. You're all aware of that. I'm new to the community, but Memorial has been here for 70 years now, serving the needs of the population, and really been committed to their mission of ensuring that there's high quality, accessible care for the community. And we want to continue to stay focused on that as we look future focused. So in 2020, we have developed a strategic plan and a master facility plan that will help to guide Memorial as we organize and look at how we can most effectively meet the needs of the community, while all the time keeping our patients at the center of everything that we do. So the Yakima market is very unique in a variety of different ways. And we are currently working with consultants on our strategies that work nationally. And they have really pointed out some of the real challenges that are unique to Yakima that they haven't seen in other locations around the country. Certainly, we have some of the significant things that happened in 2020. And when you go from having 2 acute care hospitals to having 1 independent hospital, it creates some different dynamics. And you begin to think about what you can do differently now that you are the sole provider of resources, instead of being in a competitive environment. So we want to make sure that we are, as Memorial, are looking at ways to provide care to as many people as possible. And we want to make sure that we're working effectively with our community partners. We are so fortunate to have 3 very highly regarded FQHCs in our community. That's very unusual. And so we want to make sure we're partnering with them and other healthcare organizations to serve the needs of our population. So the Yakima market, we actually here at Memorial, we employ over 2,300 individuals. We have 160 employed physicians and advanced practice professionals, and we have 233 active medical staff members. We serve a primary service area of 166,000 people. That's in Yakima, what we determine is our primary service area. But if you look at the whole county, it's about more like 250,000 that are in the catchment area that might seek services at Memorial. One of our real challenges in this market is we do have what in healthcare we call significant government payer mix, which means that over 70% of our revenue comes from government payers, and those are the Medicare and Medicaid in healthcare. In other markets, you won't see it as high as that, but both us and Toppenish and Sunnyside really have very challenging reimbursement base as part of our business structure. Whereas if you go to the west side of the state, you have a much higher percentage of commercial insurance, which helps to subsidize your government payers. So for those of you that aren't in healthcare, when you get paid by Medicare or Medicaid, it really doesn't even cover the cost of your expenses to provide that care. And so that really leaves us with really no excess reimbursement in the market. And so we have to be very thoughtful about our limited resources and limited dollars as we look at serving the needs of the community. And if that wasn't enough, there really are significant healthcare challenges in the Yakima County around health indicators, very poor health outcomes, and we have very low health literacy in the state. Compared to the rest of the state, a lot of that has to do with primary language and making sure that people understand how to access care and how what to do and follow up to their care. So from a healthcare standpoint, there's a lot of challenges in healthcare, and there's a lot of cost challenges that have really multiplied in the last 30, 40 years. Healthcare is not the same as it was 40 years ago. And for many of these reasons on this screen here, it's become competitive in really making sure you have salaries in order to attract trained nurses and physicians and other professionals. If you don't have a competitive wage, then you really can't attract those individuals to your organization. But even more than that, there's a lot of investment that goes into healthcare in terms of making sure you have upgraded equipment, that you're keeping up with the latest equipment, that you're not letting your equipment get what we call end of life, which means you can't get parts for it anymore. You know, think of it as an old car. You can't get parts and you can't update something. And so if it fails, you don't have that piece of equipment to provide patient care. We have an old facility that was built over 70 years ago. So how do we keep up that very old infrastructure? And probably the most expensive that's been added in healthcare over the last 40 years, as in other businesses, to be honest, is information technology. Really takes up a large portion of the cost infrastructure in healthcare. On top of that, there's an increased cost of drugs and supplies as we gain more technology and understanding of how to care for patients, more drugs on the market, more equipment on the market. And then we are a highly, highly regulated business, probably only second to nuclear power plants. We have many, many regulations that we have to meet both on a state and a federal level. And there's a cost associated with those in order to be in compliance with those regulations. So this graph here may be a little confusing to those of you that aren't in healthcare, but the takeaway from this chart and why I put this in here was that we often talk about the gap between Medicare and Medicaid and the actual cost of care. And what I wanted you to take away from this is you could see the dramatic shift just from 1997 in healthcare to this is 2016 on this graph. And this data actually comes from the American Hospital Association and was provided to me by the Washington State Hospital Association. And what it's demonstrating is that it's really a negative sum game. When you have Medicaid and Medicare, what you put into providing that care, it's really a negative. You aren't covering your costs. Whereas back in 1997, it was a little bit more of at least you're basically at break even, having a government payer mix. But it's become more and more challenging in healthcare due to, you can see the loss that community hospitals are incurring due to that government payer. So I spoke in one of my previous slides that Memorial has been very focused in 2020 on developing a strategic plan. I always say you don't know where you're headed if you don't have a roadmap to show you how to get there. So we have been actively working on our strategic plan, and I also call it a living and breathing document. It's not written in stone. We look at this every day, and it guides us in terms of where do we need to put our resources and how can we best serve the community. But we also want to be future focused, and we want to make sure that everything that we do is really based around our mission and vision of the organization. So our first priority is sustainability. Now that we are the only acute care facility in Yakima, it is critical that we find ways to make sure that we are here for the community long term. And I really gave you those previous slides to show you that from a financial standpoint, sustainability is a challenge in healthcare, both locally and nationally. And if you think about the struggles that Astria Regional had for years and years, you can see that we need to make sure that we look at all of our resources and do whatever we can to have efficient and financially stable processes moving forward. So as I said, we're going to partner with our community partners. We don't have to provide everything. What are our partners already helping to provide in the community? And how can we work collaboratively together and not duplicate services? How can we leverage growth opportunities? You know, you can't cut yourself to success. You have to continue to grow as a business. And so you need to look at cost-effective processes while you're still continuing to grow. And we need to look at where are the gaps, both in access and in services locally, and determine how we can best meet the needs of serving the population. So priority number 2 is really around health equity. You know, as I said before, we have a lot of health literacy. And if you look at the demographics of Yakima County, 35% of the population only speaks Spanish. So we have a moral commitment to make sure that when people come to seek care with us, that they understand that care and they understand the next phase of how to care for themselves and how to navigate through our healthcare system. Some of our priorities here are to make sure that we have signage and materials that our customers and our patients understand. And we really need to look at how we can better communicate with our patients when they are in our health system by really looking at how we increase our bilingual capacity internally. Our priority number 3 is really around making sure that we have a safe, highly reliable, and engaged employee base. And that really goes back to our values and our mission and vision. So in healthcare, we talk about best practices and making sure that we've implemented those across our organization because they really do create a safer environment for our patients to make sure that we are providing high quality care. But through all of this, we need to continue to listen to the voice of our customer who is our community, our patients, etc., to make sure that we're meeting the needs of our customers as we build these processes and systems. Our priority number 4 is we really can't do anything without our providers, our physicians, our advanced practice providers. We need to make sure that we have a very proactive recruitment and retention, what we call physician demand plan. So a physician demand plan looks at your population and says, based on your population, how many of the different types of providers do you need in order to provide care to that population? So that guides then how many, general surgeons we hire, how many cardiologists we hire, how many different types of primary cares we hire, because we want to make sure there's access for the community. And then once again, we want to make sure that's coordinated across our outpatient, our inpatient, and our post-acute continuum of care, and that we are partnering both with our employed and our independent providers across the community to serve the needs of the population. And then priority number 5, I already told you that we have a very old infrastructure, and there's some investments that need to be made to continue to provide the highest quality care across Yakima. In 2020, we were very fortunate and we were able to invest in the organization pretty significantly. We are putting in 2 brand new cardiac catheterization labs. We have purchased a brand new, what's called a PET scanner, which is a very complex piece of equipment that helps in the diagnosis of cancer. And then we also purchased 2 brand new CT scanners. All of this equipment does not come cheap. It really is about that very expensive infrastructure in healthcare that is critical for organizations to reinvest in. But one of the other really exciting things that we're doing is beginning a modernization of our inside. If you've been inside the hospital, it feels like it's 1970s, 1990s, I think was the last time there was an upgrade. But even in this time of healthcare has changed so dramatically in terms of infection prevention. Think about all the things that we've learned over this last year about touching surfaces and cleaning and disinfection. And so this is really, really critical from our perspective because we have carpeting in areas where we shouldn't have carpeting. We have wallpaper in areas where we shouldn't have wallpaper. So we're removing all the carpeting in patient care areas, removing all the wallpaper, and refreshing it with areas that are easy to disinfect and clean. And this is what it's going to look like as we finish it floor to floor. So I'm really excited about this new, very bright, very clean look that we're going to be able to bring to our 70-year-old patient care tower. Of course, we have to do this. We can't do it big bang because we have to care for patients while we are doing this upgrade. So really, I think the first floor that is getting the upgrade is actually our labor and delivery floor. That's our 4th floor within the building. And then as patient care allows us, we will do certain wings on the various floors. And we hope that we can get this completed over a 2 to 3 year time frame as we care for patients at the same time. But very exciting. And once we can open back up, we would welcome the community to come in and see some of the great changes that we've made to the building. So I've given you a very high level sense of our strategic plan, but it's really critical that Memorial be very future focused on how best to serve the needs of the community. And really it's about growth and effectiveness, making sure that we're continuing to grow access for the community, increasing the services that we provide to the community, and working very collaboratively with our community partners. We need to look at our business and operating models and make sure that they are very sustainable and effective, and so that we are here very long term to meet the needs of the community. And that all, by doing all those things, we create a sustainable healthcare delivery platform of acute care for the community. So I'd be remiss if I was talking about healthcare and I didn't talk about COVID. This has really impacted all of us in healthcare across the nation, and particularly here in Yakima. We were hit so hard so early on, and it really was the hidden. I always talked about the fact that you didn't know what you were battling. It was the hidden enemy out there, and we were hit early in the COVID pandemic and had to learn many things as we went along. And we are much more effective now dealing with COVID because we've learned so much over the last year. So many of you have seen these graphs before. The takeaway from this is COVID's not over. I wish it was. I wish we were on a plane to get ready to come out of the pandemic. But particularly due to the super spreader events of holidays, et cetera, we still have COVID very actively, both in our community and nationwide. This is showing you Washington State. And unfortunately, Yakima continues to be a hotspot within Washington. Although I will tell you that we went from having 60 inpatient COVID patients down to 40 this week, which is very, very promising information to us. We're watching that very carefully. It doesn't mean that there's still not a lot of COVID in the community, because I will tell you that as of yesterday, the positivity rate in Yakima for a 7-day rolling average was 55%. So that means of everybody tested, 55% of them were positive. That is extremely, extremely high. So we still need to remain vigilant in order to get to the other side of the pandemic. So early on at Memorial, back last March, April, May, it really came to a head in June. We had more COVID patients at Memorial than all of King County combined. We were not proud of it, but at one point we were rated number 3 in the nation for new COVID cases. That was last year, and thanks to the collaboration that we had across the state, we would not have gotten through it without that collaboration. Collaboration with the health district, with the Washington State Hospital Association, with the Washington Department of Health, and the governor. When the governor flew in last June, when we were in dire straits, that really helped us to begin to turn the corner. And really, we have had great partnerships as we have looked at how we can best meet the needs of Yakima County in terms of COVID. So we actually work with the health district around COVID testing at the Sun Dome. They have very limited resources. We provide staffing, et cetera. We're partnering with the health district around vaccination distribution. And we have begun monthly community leader updates that have been very effective and really getting the word out on current state. We have our next one tomorrow. Last time we had over 100 business leaders across Yakima County that came to our COVID update to help them better understand how they can navigate through this pandemic. So the number one thing that I get asked about is the vaccine, and when can I get access to the vaccine? This, what I'm showing you right here, is what the Department of Health has put out from a state level in terms of what their plans are around the vaccine phases. And we are required to follow this, or we put into jeopardy getting any vaccine from the state. So we are taking direction from the state. I will tell you, I think this is a very aggressive and optimistic timeline. We are still in this A1, A2 phase right now, at least here locally and across the state. I think we've done an outstanding job of really making sure that the vaccine that we have been provided with here locally is getting into the arms of individuals, because the governor really doesn't want to move into the B1 until they finish the A1 and 2s across the state. I think the other thing in conversations that I've had with the governor's office that I was very pleased about is they identified that certainly in our agricultural areas like Yakima, it's going to be really critical that we proactively vaccinate some of our agricultural workers, particularly when spring comes and we have crops that need to be dealt with. So very pleased to see that they moved those up in their timing. I would say that the one concern I have is that it's 50 years and older, and we have a lot of younger individuals that work in our agriculture. And I gave the governor's office that feedback. So really proactively looking at how we can best manage those workforces, because that's really where Yakima struggled last year, was with our agricultural workforce and making sure that they had the tools and resources to be safe during the pandemic. So on my last slide here is the website that if people ask you questions about the vaccine, that you can direct them to. I will tell you, this is a state website. It's a work in progress. The state is working on what they're calling their phase finder. It's like an app where you can put in your information and find out where you can go to get the vaccine. I don't think they have that up and functional yet. And they're also working on a vaccine dashboard so that all of us can see who's been vaccinated where, and help as that moves forward. So let me then pause there, and that's the end of my presentation, and see if there's any questions that I can answer for any of you.
I have a question. I'm Mal Arnett. I'll be 84 years of age coming up here, and dealing with cancer over at North Star. And I have, because we don't have the oh, what do you call it? Available here in Yakima, I have to, they're sending me over. I either go to Seattle or Spokane for a test. And it is an MRI biopsy. And I guess what I'm wondering, why can't we do that here in Yakima rather than running, you know, a few hundred miles for a test?
Well, thank you for that question, Malcolm. I'd have to have a little bit more information about that, but if you want to send me an email or give me your phone number, I'd be glad to talk to you about that further so that I can better understand what those types of services are.
Okay, that is a personal question that really is not relevant, but I was also, one more and then I'll be quiet. I was wondering also, what's your estimation? Will the other hospital be open again to provide services for Yakima?
So part of what I was trying to help the community understand in my PowerPoint is that this is a very, very challenging market economically for healthcare. And there's a reason that hospital closed. It could not financially be viable for years and years, which is why you saw it change ownership over and over again, because it couldn't pay its bills. It didn't have a positive line. When we look at the population of Yakima, it really is a one acute care hospital town, and there are metrics that healthcare uses to determine that. What you also need to understand about the old hospital is it's not a hospital anymore, it's a building. In healthcare, you have to have what's called a certificate of need. And when that closed, they turned all those certificate of needs back into the state. And so it's no longer designated as a healthcare facility.
Okay, thank you.
Other questions that I could answer? And Malcolm, feel free to reach out to me. I can send you my phone number or email so I can help you with your question.
Thank you.
I'm wondering about, with the cost of care that you referenced very clearly, are other healthcare organizations or hospitals seeking to engage Memorial again in a partnership, and or are you on the lookout for other partnerships?
Well, that's a great question, Phyllis. And, really what we're doing right now is, unwinding from an affiliation is a very unique thing. And we had to do it very quickly. So we really are focused on really improving Memorial and standing up all of our systems and processes and really getting a healthy financial bottom line. In the future, we may need a partner, but we're not focused on that in the short term. We want to see how well we can stabilize our services here locally and remain independent as long as it is viable for Memorial. At the end of the day, our mission is to make sure that there's access to healthcare for Yakima. And so that's really what we're focused in on, is making sure that, 20 years from now, Memorial is here to serve the needs of the community.
Carole, my name's Amy, and I was wondering about some of the statistics that you might have about our healthcare providers there at the hospital who have maybe gotten ill or contracted COVID, and if any have passed away from contracting COVID, since it sounds like our numbers were like at one point, like you said, third highest in the country. I'm wondering that, and I'm also wondering on the flip side of that, if there are any plans or if there's any strategies for mental health things that our physicians and nurses and people who are at the hospital might be able to take advantage of in the next year, whenever, as this settles down.
That's a great question, Amy. So I'm going to answer the first part, and then I'm going to have Erin answer the second, because she actually got a grant around providing some of those services. So we have been extremely fortunate, Amy, knock on wood. We have not had any care providers pass away from COVID. And during the first phase of the pandemic, you probably all know we shut down the building very quickly to access. We had plenty of personal protective equipment, the masks, the gowns, all the things we needed to care for patients. And we really did an outstanding job protecting our workforce. Board members will tell you that was my number one focus, is making sure that we are protecting our workforce. As the pandemic has gone on, our workforce is no different than the rest of the population, which means as they're out in the community, as they meet with people outside of their pod, they get exposed to COVID. So our employees now are, we typically have been having anywhere from 60 to 100 employees out each day with either COVID symptoms or exposure to COVID. I'm beginning to see that come down, and we're beginning to see COVID inpatients come down. So I'm very optimistic that maybe we're on the downward curve now. But certainly, because the pandemic's gone on so long, Amy, our workforce has been impacted with it. But also the positive thing is our workforce, our frontline people caring for COVID patients every day, were the first people to get the vaccine. And so I believe 70% of our employees have now gotten the vaccine. It is voluntary. We can't mandate it. And so we just continue to encourage our individuals that provide patient care to get that vaccine and protect themselves in the workforce. Erin, do you want to answer Amy's question about behavioral health resources?
Yeah, so Amy, can you, I missed that second part of the question. Can you restate that? And Carole, are you talking about the behavioral health grant that we received for Children's Village?
No, the one for COVID patient employees.
Oh, yes. Yes, okay, I can answer that. In terms of behavioral health, we did receive a grant to support what we formed as the COVID emotional support team. And this was undertaken by licensed social workers, and we also had bilingual capabilities. And so this was set up not just for the hospital team members and staff and providers, but also for the entire community. And in fact, we distributed flyers and information in Spanish and English and through the ag community. So we started that probably 2 or 3 months after COVID hit our community pretty hard. And it has proven very successful in that we've had several calls based off of conversations that I've had with the licensed social workers, several calls where people were at the point of being suicidal, having severe depression. And so being able to have a line to contact where you're confidential, names aren't required, but getting to people sooner rather than later. And I would say that in talking with the social workers, what we found is a lot of people being, sort of depressed and that feeling of isolation and picking up the phone and calling, really associating with COVID. But a lot of times people wouldn't self-identify themselves as having suicidal thoughts. And so talking with someone who is skilled and an expert in working with individuals that are going through tough times, they were able to navigate and see those signs and help people get the extra support they needed. So we were really thankful to receive that grant to help support this line.
So there's a question in the chat box that I want to address. So it looks like Orson put in, has Yakima ever considered the creation of a hospital district? So part of my job as the CEO is now that we are a independent organization is to look at making sure that we are leveraging all possibilities of reimbursement for sustainability, both on a federal and a state level. And certainly we've looked at what does it mean to be a hospital district. To me, that would be very challenging because you'd have to put in a tax and the community would have to vote on that. So it's not something you can just say you want to be. There's actually legislation that is attached to that and the community would have to vote on that. And there's challenges. There's pluses and minuses to hospital district, etc. So right now we're not considering that as an option. I think there are other things that we're exploring. I've spent a lot of time with state legislators, talking to the Washington State Hospital Association, talking to other independent hospitals across Washington. And so my job is really to look at what are all the different options out there. How could we get some enhanced Medicaid reimbursement on a state level? And what can we look at from a federal level that might help us around government reimbursement? There are programs out there. Some of them we qualify for, some of them we don't. We are very unique here in that we are actually designated as urban because of the population base. And many of the programs, both on a federal and state level, are set up to support rural and smaller hospitals. So we're kind of in the middle, stuck in the middle, but we keep peeling the onion back and looking at all opportunities.
Hi, Carol. My name is Mina Worthington. I have a question for you. So you mentioned that you've now disaffiliated. You've got to kind of pull the pieces back together for Yakima Valley Memorial Hospital, and I think that when you are in that situation with a business, any business, that there are going to be changes that are going to be necessary, and changes are sometimes difficult. And so my question to you is, as a community member, how might I and others support the hospital through those changes?
Thank you for that question, Mina, because change is always hard for all of us. And so what we're doing right now as part of our strategic planning is really assessing how we can best do that. We have a pretty, one example is we have a very distributed physical footprint. We have 27 ambulatory sites. So strategically, we're asking ourselves, do we really need 27 different sites? Is there economic benefit to consolidating some of those? Is there a customer benefit so that I, as the customer, don't have to, I have to drive here to see my doctor. Then I got to drive over here to go get my x-ray. Oh, and then I got to drive over there to get my medications. Is there a way that we can maybe more effectively provide those access points that are cost effective and customer focused? So that's actually part of our strategic plan because it could help us from a financial standpoint, because all of those 27 sites, those cost dollars to support and stand up. We haven't made final decisions on that yet, but as you see some of those decisions made moving forward, that's what I would really look for all of you is, certainly we welcome feedback, but everything we want to do through the lens of the customer and helping also our community understand the why behind maybe why we might consolidate some footprints, or why we might recruit certain types of services, but not other services. And we will be as transparent as we can be as we work through our strategic plan and understand the answers to many of those questions that I know have been out there.
Question.
Yes.
Greg Stewart here. So I'm wondering, how do you compare the operations between our hospital here in Yakima and the hospital in Wenatchee? I've often seen that the two have been compared.
There's a lot of similarities, Greg, and there's some differences. And I have spent a lot of time on the phone with the CEO there, Peter Rutherford, because I think that he has done some very innovative and creative things to help Wenatchee be successful. Let me tell you that Wenatchee also struggles with, having financial sustainability, and they have to ask a lot of the same questions that we're asking now. And I learned that by talking to their CEO. So some of the things that Wenatchee has that are different than Yakima. Number one, remember I just talked about urban versus rural. They are designated as rural. And they get some enhanced reimbursement for that. They also have what are called rural health clinics, which also provide them enhanced reimbursement. And then they also have what is called designation from the federal government as sole community provider. There is enhanced reimbursement with that. That is something that we're looking at and exploring in Yakima, but Wenatchee has that, and that does provide significant revenue enhancement to Wenatchee. So those on the surface are some of the major financial differences, Greg, between Yakima and Wenatchee. Now that we are the sole community provider of acute care, it opens new options and doors for us in a very positive way, which is what we're really trying to understand and move forward on now.
Thank you.
This is Jane Davis. I'm the administrator for Landmark. And one of the things that, previously we were not allowed to do telemedicine and be reimbursed for it because we were actually considered urban, and now they've moved it to rural. Would there be a possibility that they could change the classification of the Yakima area due to shortages of nurses, providers, and the list goes on?
That's a complicated question because the federal government defines it differently than the state government. And it is based on population. Of course, one of the benefits of the pandemic was that they did enhance that telemedicine reimbursement. And so we're hoping that they retain that long term. It's the right thing to do, is to have all those different access points. So I will tell you, we probably have avenues to be redesignated federally as rural, but I'm still exploring whether there's any state ways to get redesignated as rural. And so far I haven't found those. So it's a complicated, like I said, onion where you have to peel back all of this regulations and rules and regs.
And I know that with the Medicaid reimbursement for the state financially has some big challenges ahead of them. So not only looking to cut hospitals, but they're looking to cut us and the care that we provide.
And that would be devastating to Yakima because it is such a fine line in terms of reimbursement here. We are so dependent on the Medicaid and Medicare reimbursement. And as I tried to demonstrate to you, the care that we provide to people, Medicaid does not cover the cost of our employees, the cost of the drugs. It is a fraction of what we spend on every patient.
Hey, Carole.
Yes.
This is Malcolm. In essence of time, it looks like we're about ready to adjourn here, but I wanted to give you a shout out for two things. One is that I had to go to Memorial I thought I had the COVID. Temperature went up. You guys did a fantastic job from the time I entered until I left. And I just want to thank you for that great service that you gave. And then on your strategic plan, the third slide, that is my granddaughter that you had on the picture. Her name is Corinne.
Oh,
And so I don't know whether, I hadn't seen that picture before, but it was wonderful seeing her. Thank you so much.
I have to look at that slide again, Malcolm, and see what it was a picture of. Thank you for that.
Well, I was disappointed that I wasn't on it, but that's okay.
We weren't.
There's one more question in the chat box that I want to make sure I answer, Phyllis. Is there a list of medical test procedures that Memorial is not qualified to provide? I'd probably flip that around and tell you, go to the website and it'll tell you what services we provide. And then we continue to look at how we can expand services. So it's not that we can't provide them, it's that do we have the resources, the physicians, and we're continuing to look at to expand that.
Well, Carole, I'm going to just go ahead and start to wrap us up since we are at our time. Would you be willing to stay on after the official adjournment for any remaining questions?
Absolutely.
Okay, that would be wonderful. Thank you. And in honor of you speaking today, we are going to be making a donation in your name to our Yakima Rotary charities. And we just appreciate you taking the time to share with us today. So thank you very much.
Thank you.
As we wrap up our agenda, we have Connie Phelan with our Rotarians Going Places. Connie.
Well, welcome everybody. What a great talk, Carole. I loved it. It's good to keep everybody informed. And so I'm going to present another fantastic Rotarian going places and making a difference. And that's our very own Rotarian, Dave Brown. He, for those of you that don't know, he's an assistant director of Public Works, Water/Irrigation for the city of Yakima. And he was very instrumental with his team to be one of 8 cities in Washington that received the Gold Award for our fabulous drinking water and meeting and exceeding several standards. And so the great drinking water for Yakima. Thank you, Dave, for allowing us to have healthy, good drinking water, but also environmentally, people buy a lot of bottled water, and not taking anything away from the retailers, but it will help save our landfills by using our own tap drinking water out of our good city of Yakima faucets. And so thank you, Dave. There's much more to say about this, but we are short on time. And there's another fabulous Rotarian going places and making a difference. Thank you.
Thank you so much, Connie. It's always wonderful to celebrate our Rotarians Going Places. So next week, we've got a program with our very own Rob Phillips, who is going to talk about his new book. And if you haven't picked it up, you might want to do so in advance of next week's meeting. We're looking forward to that. The following week, we're going to be joined on Zoom by Jorita Solari. She is a Rotary International former director, and it's really going to be great to have her Zoom in. And then following that, it is our celebration of Black History Month with James Joyce III joining in. So some exciting programs. We'll look forward to seeing you all. And with that, we are officially adjourned.